Let's dive into the first topic of our podcast, focusing on rib lesions. Rib lesions can be classified into two main categories, benign and aggressive. Each type has distinct characteristics and implications, so understanding these differences is crucial for accurate diagnosis and management. Benign rib lesions. Starting with benign lesions, we have congenital abnormalities. These occur when the upper ribs are bifid, splayed, fused, or hypoplastic. Such abnormalities are sometimes associated with various syndromes, like basal cell nevus syndrome or Sprengel's deformity. A notable example is the cervical rib, which arises from C7 and is present in about 1 to 2% of the population. This rib usually slopes downward from the spine and can sometimes cause thoracic outlet syndrome. It's often bilateral and asymmetrical, which can lead to a variety of clinical symptoms, including nerve compression and vascular issues. Another benign condition to consider is the formation of a callus post-fracture. This bony growth can sometimes mimic an intrapulmonary opacity on imaging, which can be confusing if the patient's history of rib fracture is not known. Recognizing this as a callus rather than a new lesion is important for preventing misdiagnosis. Next, we have rib notching, which occurs due to external pressure on a rib. This is commonly seen in conditions like coarctation of the aorta or neurofibromatosis type 1, NF1. In the case of coarctation, the increased blood flow through the intercostal arteries causes the ribs to notch over time. Neurofibromatosis, on the other hand, may cause similar changes due to tumor growth affecting the ribs. Benign primary tumors of the ribs are another important category. Although infrequent, these tumors are most commonly cartilaginous in nature, such as chondromas or osteochondromas. They predominantly occur in an anterior location and often present with characteristic cartilaginous calcifications on imaging. Recognizing these calcifications can help distinguish these benign tumors from more aggressive forms. Aggressive rib lesions. On the other side of the spectrum, we have aggressive rib lesions. These are usually much more concerning and require prompt attention. Destructive rib lesions are most commonly associated with osteomyelitis or a neoplastic disease. Malignant rib tumors often manifest as metastatic deposits from primary cancers such as breast, prostate, or thyroid cancer. While primary malignant tumors of the rib are rare, when they do occur, they are usually chondrosarcomas. These tumors can cause significant destruction of the rib structure, which is often evident on imaging. Osteomyelitis is another aggressive lesion but is less common. It results from an infection spreading to the bone, either through the bloodstream, hematogenous spread, or directly from adjacent infections, such as those in the lung or pleura. Conditions like staphylococcal or tuberculous infections can extend into the ribs, causing significant bone damage. Lastly, we must consider bronchial carcinoma, particularly Pancoast tumors. These are a type of lung cancer that invades the upper ribs and can have serious implications. Pancoast tumors are notorious for causing a variety of symptoms due to their proximity to the brachial plexus and other critical structures. Imaging, particularly MRI, is vital for assessing the extent of these tumors and understanding their relationship with surrounding tissues, such as the brachial plexus. In summary, rib lesions range from benign conditions like congenital abnormalities and callus formation to more serious aggressive conditions like malignant tumors and osteomyelitis. Understanding the characteristics of each can greatly aid in accurate diagnosis and appropriate management. Stay tuned as we continue to explore more topics in radiology in the next segment of our podcast.